how did the experience both, of the pandemic as as affected all of us, but then also being within the organization shape your approach to kind of leadership?
A lot of what we were starting to see in terms of early demand were products in the ICU setting, even before the pandemic really hit to the level it did. And that was when we started to see that there something was happening in hospitals around the world. And obviously, we began to know what it was only the beginning of what was really to come. And during that period of time, which was about March or April of 2020, I actually came into the role in April of 2020 in the middle of this massive crisis as we were trying to deliver products around the world. I mean, just to kind of give you a flavor, we were delivering in the US 1,000 emergency shipments per week. That is unprecedented in terms of the kind of demand that was out there. So when we think about the products that were needed for, ventilated patients, for patients in ICU, those were the products that were in high urgent demand. In some cases, 600 to 800% of normal demand. So the team, in a rapid response fashion, really engaged with leading healthcare systems, engaged with hospitals to find out where their needs were, what their needs were, and then, of course, making commitments to make sure that we got the medicines to patients where they needed it. So for that period of time of 2020, it was a very intense time for everyone in the world. But I will say, in terms of what the hospital business unit was able to deliver, making sure that we got medicines to patients around the world who needed them. And then during that same period of time, because we do work in the hospital setting and anti-infective and antiviral medicines sit within the HBU, we were also developing a protease inhibitor oral treatment for COVID. So that was running alongside some of the urgent care needs that we needed in the hospital setting, just to kind of give you a flavor.